Hello everyone, in this video we're gonna talk about sweat chloride test which used for diagnosing cystic fibrosis. First, we must know what is chloride. Chloride is a major anion of extracellular fluid. Chloride can move easily across the membrane following sodium. Chloride has several functions in our body such as maintaining proper hydration, electrical neutrality of fluid, and also to maintain osmotic pressure. For the clinical significance of chloride, we can see conditions such as hypochloremia, which means low level of chloride in the blood. This condition can be caused by prolonged diarrhea or vomiting, defective tubular renal absorption, and metabolic alkalosis. Meanwhile, for hypochloremia, which means high level of chloride in blood, can be caused by dehydration, excessive intake of salt, as well as metabolic acidosis. One of the clinical applications for chloride measurement is for diagnosing cystic fibrosis. Now, let's take a look on overview of cystic fibrosis. Cystic fibrosis is an inherited disease that can affect human lungs, pancreas, and sweat glands. This condition is caused by a mutation in CFTR gene on chromosome 7. Function of CFTR gene is to maintain balance of salt and water in the body. When CFTR protein is not working properly, chloride is trapped in cell, and if there is no proper movement of chloride, water cannot hydrate the cellular surface. This will lead to build-up of sticky mucus causing respiratory infections and impaired function of pancreas. Cystic fibrosis patient can develop several symptoms. If the patient has respiratory problems, they may have symptoms like wheezing, shortness of breath, persistent cough, and recurrent lung infection. Meanwhile, for patients with digestive problems, may have symptoms like nausea, constipation, loss of appetite, and delayed growth in children. There is no cure for cystic fibrosis has found until today. However, several treatments are available to relieve the symptoms such as antibiotics and CFTR modulator. Sweat chloride test is a test done by measuring the amount of chloride concentration in sweat. It is commonly used to evaluate cystic fibrosis. This is because patient with cystic fibrosis has defect at CFTR gene which causes an alteration in absorption of sodium which then reduces the permeability of chloride in sweat ducts. This condition leads to patients with cystic fibrosis to have a higher concentration of chloride in their sweats compared to normal people. This test is performed after the assessment of family history suspected for cystic fibrosis disease, or when a person exhibits signs and symptoms of cystic fibrosis, and lastly, when genetic testing for cystic fibrosis shows positive or intermediate results. Now let's take a look on the principle of sweat chloride test. Principle of the test involve 3 steps, which are stimulation, collection, and analysis. Step 1 is the stimulation of sweat glands using the pilocarpine iontophoresis method, which means pilocarpine is a type of drug. Meanwhile, iontophoresis is an electric current. So, the pilocarpine will be introduced into skin layer using an electric current. The electric current will carry pilocarpine to stimulate sweat glands. Step 2 is collection. Once the skin starts producing the sweat will be collected using cotton gauze, filter paper, or microduct. And the last step is analysis of sweat sample. The concentration of chloride will be analyzed quantitatively either using chloridometer, manual titration, or automated analyzer. Next, let's look into the procedure of this test. First, clean the patient's hand. Pads that soak with pilocarpine are placed on the skin. Electrodes are then used to move the chemical into sweat glands. Leave it for 5 minutes. Then pad and electrodes are removed. We can see that the area starts to stimulate sweat. Sweats are collected for 30 minutes. The collected sweat are sent to the lab for the test. The normal sweat chloride level is 10 to 35 millimole per liter. From this table, we can see the range of sweat chloride level and how to interpret it. By using this test, it is much more easier to perform and less time consuming. However, in some cases, the side of the skin may show redness and produce sunburn, and sometimes the sweat may produce excessively for short period of time. Other than that, some infants may not sweat enough to do the test. When the infant does not produce enough sweat for the first time, the test should be repeated. That's all from us. Thank you for watching.